Let's bring in Republican Senator Mike Crapo, who's joining us from D.C. Senator, I looked up the legal definition of bribery in the dictionary, and here's what it said. A, quote, a secret payment to a public officer in exchange for preferential treatment. By the way, it also pointed out that bribery is illegal. It seems like a lot of that's going on with this health care bill. Am I wrong?
No, you're right completely. As a matter of fact, all across this country, people are outraged by the fact that they see the United States Senate making law this way. We have the Louisiana Purchase, we have the Nebraska Sweet Deals, we have the Florida, what's now been called Gator Aid, we have the special hospital funding for Connecticut, and the list goes on. And frankly, the process, which started behind closed doors and has now ended without the public having an opportunity to really dig into this bill and see what's in it before the final vote is forced, is one that really has soured the American public.
So, Senator, basically, there's nothing you can do.
Well, at this point, as far as the Senate bill, it looks like a pretty significant, foregone conclusion that tomorrow morning Senator Reid will have the 50 votes that he needs, 51. He probably will even keep his 60 together in order to pass the bill. But it's not over yet. We still have to see this bill go to the House. We don't know whether they will avoid bringing it back to the Senate through some more procedural maneuvers or not. But the American public still has a chance to weigh in. And frankly, if there's any message that I could give to the people in this country, it's to call your senator now and tell them how you feel, and call your representatives now, too, because the ball's going to move back into their court.
Sir, tomorrow's vote is probably a foregone conclusion. We all know that they're going to push it right through and get it done. So then the big question is, when the House and the Senate have to come together and merge these bills, which have some real big differentials, do you think that's enough to kill this, or will the House and the Senate come together on some version of Medicare, abortion rights, the public option, come together enough to push this thing through?
Well, you know, it's all speculation right now, but I believe that they are pretty well convinced in both the House and the Senate that if this bill has to make another run in the Senate, it simply won't make it. Once the 60 Democrat senators go home for a few weeks and hear from their constituents, I don't think there could be another successful 60-vote push in the Senate. And so because of that, I believe that one way or the other, they will either use a procedural mechanism to change the bill without subjecting it to a filibuster, and there are a few that they could try to tinker with there, or they will simply see if they can't get the House to admit that they've got 90% of what they wanted and take that now and just vote on the Senate bill.
Right. Hey, Senator, what if some of the other senators say, hey, Ben Nelson in Nebraska got himself a pretty sweet deal, the Florida senator as well. What if one of the other Democratic senators say, hey, what about us? And they start, pushing for, maybe rethinking the vote. Is that possible, or are we already past that?
Well, they could still do that before tomorrow morning at 7 a.m. and say, wait a minute, I won't do this. But frankly, at this point, Senator Reid can pass the bill in the morning with only 51 votes. So it would take 8 or 9 of them to change their minds. I think we're past that. And frankly, I think they owe their constituents a bit of an explanation as to why they allowed a bill with this kind of pork barrel politicking in it to go forward.
But, Senator, this has been going on the Hill since you guys have existed up there, where you exchange this for that. It's just that it's not you and your party doing it, and now all of a sudden, and if it was vice versa, the Democrats would be saying, oh, yeah, look, they traded this for that. So, I mean, we all hate that, regardless of which party it comes from. Let's talk about this whole constitutionality of this. We have some attorney generals looking into what Eric brought up, whether this trade for Nebraska and so forth, whether that's legal, and in general, health care, whether it's constitutional to force the government for all Americans to buy it. Where is that going to go from here?
Well, first of all, let me say I agree that there's been log rolling in politics forever, but to this degree, I just got to say I don't think we've seen it for maybe forever to this level. I mean, to the level that the constitutionality of it is actually in question. I think at this point they have been able to procedurally stop all of the challenges on the constitutional issues and on the other issues, and so it'll probably end up going to court if it does eventually pass.
Can I just throw this in here? My son took a social studies test today. Social democracy. You know what it is? You pay high taxes and you get things like free health care. You get things like help if you're out of work, help if you're sick, help if you're disabled. We've become a social democracy. We've gone from a free market to a social. But the last straw, Senator, the last straw was health care, if I'm not mistaken. Am I wrong?
We've had Medicare and Medicaid for decades.
We have had a significant amount of government control over the healthcare economy for decades through Medicare and Medicaid. But the whole battle this year in the Congress has not really been over whether to reduce health care costs or to find out a way to get improved access, improved quality. The battle has been exactly that. Namely, an effort to push us to the finish line to totally have a complete single-payer system. And like I said a minute ago, this bill didn't quite get to the full 100% government control, but it went way down the road past where we have ever been and essentially put the infrastructure in place for that final push over the finish line. And that is what this whole battle has been about.
Well, Senator Mike Crapo, thank you for joining us. Please don't give up on tort reform and the antitrust and across state markets, all that too. Please, thank you for joining us.
We're going to keep fighting for the right kinds of reforms.
All right.